Sometimes you can meet the diagnosis criteria for dyslexia with the school evaluations if they've done these additional testings that you've requested. Let's review again the IEP versus the 504. An IEP is a plan of special education designed to meet the needs of the individual, versus a 504 is a plan of accommodations and modifications designed to meet the needs of an individual to be carried out alongside the general curriculum. An IEP supports 13 diagnoses versus a 504 supports any medical diagnosis that may be impacting the child's ability to learn in a regular school setting. If there are specific concerns for dyslexia, ask for phonemic awareness testing. If there are specific concerns for autism, ask for an ASRS or another form of behavioral testing. And of course, if possible, ask for an ADOS. Okay, let's dive in a little bit more now on the process to get the accommodations. So after the child's evaluation, the school will qualify them for either a specially designed instruction or services and changes in their learning environment or no additional support. This flow sheet is a guide through the process from start to finish. The first steps: request a letter from the parent or a referral from the school to initiate an evaluation. Then, testing is done during the school by pulling the child out of their regular classes throughout the testing process. Next, the MET report is created, which provides parents and staff with a review of the results. Ideally, parents should have a copy of the report prior to their meeting so they can review the results with you or an advocate. Following the MET report is the MET meeting. During this meeting, the school will qualify the child for an IEP, a 504, or they will be denied services and will continue with the regular curriculum. If a parent disagrees with the decision that has been made, then they may decide to get an independent educational evaluation, or an IEE. Parents that choose to get a second opinion will meet again with the group to review the outsider's recommendations of support. Then a final decision will be made in the form of a written document that is created at the conclusion of the meeting. So let's go into this a little bit deeper. MET, or MET, stands for Multidisciplinary Evaluation Team. These qualified professionals evaluate students, determine eligibility for services, meet with parents, and present testing results to parents. Parents are also part of the MET and can expect to play an active role in the process. Evaluations can be conducted for intelligence, speech, and school performance. All of these evaluations will factor into the MET eligibility determination. The MET meeting is meant to review and discuss all the evaluation information. So during this meeting, staff and parents review the results, and then parents are given a choice of the next steps. This is the MET eligibility determination. The eligibility determination is the final step of the process prior to a written document, as a student can only be determined eligible for special education services through an IEP if the student has one of the 13 qualifying disabilities, the disability impacts the student's learning, and there is a need for specially designed instruction. Parents are part of this evaluation team and do not have to agree with the eligibility determination nor sign off on anything the MET has proposed. For parents to be best prepared, they should be given and have a chance to review the MET prior to their meeting. Parents usually need help reviewing the results. This is a role the pediatrician can play, or an advocate. You can review the report with parents so they can advocate for their child's needs and future success. At this meeting, it is very important that parents are aware that results are typically presented on a bell curve and understand what this graph means. The MET will inform parents if their child's scores are below or above the 15th percentile or a standard score, known as SS, of 85. You can help them by showing them this graph ahead of time. Providers can also diagnose a disability based on the results of the MET report or other information gathered through this process. This way, the parent can attend the MET meeting with a medical diagnosis warranting the child will at least be eligible for a 504 if they don't meet criteria for an IEP. Providers should also inform parents of their rights. Parents may ask for additional testing to be done by the school, just like we discussed earlier, but this doesn't guarantee that the public educational agency will do it. If they deny their requests and the parents still want more testing, then it's time to request an IEE. When a parent or caregiver disagrees with the MET eligibility determination, they have the right to request a second opinion at the expense of the public education agency. This is called an IEE, an independent educational evaluation. On the other hand, if the public education agency believes their evaluation was appropriate, then they can file for a hearing to show that the student received an appropriate evaluation. This is called a due process complaint. If the PEA's evaluation is concluded appropriate, the parent still has the right to get an IEE, just not at the public's expense. So no matter who pays for the IEE, the results must be considered by the MET to determine your patient's eligibility for school support. Let's review the process. Evaluation is the first step, and the process starts by a parent request or a school referral. The MET, Multidisciplinary Evaluation Team, which includes parents, compiles testing results into the MET report. Providers can review the report with parents. At the MET meeting, the MET will make their eligibility determination for A, a specially designed instruction, or IEP, B, services and changes in their learning environment, or 504, or C, ineligible for additional support. Schools typically determine eligibility through patient scoring of less than 15th percentile, or a SS, which is a standard score of 85, which is typically presented on the bell curve for parents to view. Keep in mind that this is not in all states, and some states require children to score lower than 6th percentile. Parents can request an IEE, Independent Education Evaluation, as a second opinion if they do not agree with the results of the MET. That second opinion is considered by the public education agency, but it is not a guarantee to be paid for by the public education agency. Let's examine the school support a bit further. Hopefully by now there is a final written plan of additional educational support provided through an IEP or the accommodations provided through a 504. As we know, both plans are legal documents, but let's take a closer look at what these plans entail. An IEP guides the delivery of special education and additional services designed to improve the child's educational results. IEPs are required for students participating in special education programs as recipients of funding under the IDEA. IEP may include how many minutes per month the speech therapy or specialized education goals will be, but the overall goal of an IEP is for the students to be involved in and progress into a general education curriculum as much as possible. Many times parents believe that once they get an IEP, their child will be graduated through each grade, but this is not always the case. The goal is for the student to catch up, build a foundation, and be able to continue into the general education curriculum. This can only be done if the disability the child has is addressed early. Otherwise, they miss a large portion of their foundation, and it becomes hard for the children to transition into a general education classroom after the IEP has been established late in their progress through school. A 504 outlines a plan of accommodations for students to utilize in the general education setting. A 504 may describe the types of accommodations that can be made for a student and the medical diagnosis that impacts the ability to learn. This document allows a wide range of diagnoses, so it is bound to look unique from one student to another. Here are some examples of accommodations available. Using a wiggly chair or a rubber band around the base of the normal chair, chewing gum, fidget toys, taking breaks, verbal communication over written communication, or an FM system for teachers to speak directly through child's headphones for auditory processing or ADHD inattentive type. Once accommodations are written, they are only readdressed if changes are needed. Children with a disability or a medical condition that does not interfere with grades or scholastic achievement can still get a 504 to provide accommodations in school. Remember, the purpose of the Section 504 is to prohibit discrimination. So, if a child has a heart condition that makes them fatigue easily or restricts their school attendance, they will be missing a lot of school education, and they should be provided notes from the teachers, additional time to complete work or tests, or any of the examples shown above, such as providing a shorter school day or allowing written reports over oral. But if parents believe that the child is not reaching their full potential, it is recommended that they get a full evaluation to determine any diagnosis and additional supports they may need. The services provided to patients that have qualified for an IEP will range quite drastically since instruction is individually designed. Students will have their plan reviewed every year to see their progress that they have made towards their individualized goal, and every 3 years the child will be re-evaluated to redetermine their eligibility for special education. Technically, if they have any of the 13 diagnoses, or if a parent requests an evaluation, the school must evaluate first to determine if a child needs an IEP. Then, if they are not below the standard score of 85 or 15th percentile in any area, they can do a 504. But schools often just do what they want. For example, if a child has a medical diagnosis of dyslexia, also known as a specific learning disorder with reading impairment, which does qualify as a diagnosis for an IEP, they still need to be evaluated to determine if the child falls under that 15th percentile. Only then can they determine if the child qualifies for an IEP versus a 504. Let's go into this a bit further. It used to be that if a parent said that their child had dyslexia, the school would automatically say, "Your child does not qualify for an IEP. You can get a 504. This is incorrect, and many states are now strictly enforcing children's right to a free, appropriate public education. The Arizona Dyslexia Handbook requires that students receive a full and individual evaluation to determine if the child falls below the 15th percentile and warrants additional specialized school support. Even if a child does qualify for an IEP, unfortunately, not all schools are teaching dyslexia-specific education methods, and many do not provide additional intense focused education for a child with dyslexia that teaches them how to learn and to read. This is a skill that carries on with children for the rest of their lives. So after going through the entire process, your patient with dyslexia may have to push through a few more obstacles to get their needs met. Here's a summary of accommodations outlined in the Arizona Dyslexia Handbook. Audiobooks, where the child can listen and watch the text in their actual books, text-synced audiobooks, text-to-speech apps or software, using a dictionary for written work, tutors, reduced course load, smaller classes, longer time to complete work or tests, the ability to answer questions verbally instead of in a written form, especially for areas that do not test for their writing ability. So history or science doesn't require them to write the answer, and their grades should not be reflected by their written response. Advise parents to review this handbook so they are aware of the accommodations provided by a public agency for their child to receive a free, appropriate public education. Additionally, recommend parents ensure that their child's school is familiar with this document and aware of all the accommodations available for the child. You can visit drkaranababy101.com or scan this QR code to watch a dyslexia education webinar for more information regarding Orton-Gillingham and Spalding-based reading education and the Barton Reading Program, which are additional resources for children to learn appropriately if they have dyslexia. As promised, here are some samples of verbiage that you can give to your patients to use in letters. The verbiage of these letters is important since existing teachers, unlike newer teachers, receive very brief amounts of education and training on the laws in place for students to receive a free, appropriate education, the process to receive special education or related services, and lastly, the type of support needed for our patients with disabilities. But, even worse, a public agency's staff and teachers are often unaware of all the hard work put to pass these accommodations through the government by researchers, parents, educationers, and advocates. This lack of knowledge leaves our patients far below their potential level of success and happiness.